Hey everybody, this is Kevin McFarland from The Art of Emergency Nursing, and you're listening to 30 Days to Being a Badass ER Nurse. In the next 30 days, I'm going to give you some quick tips and tricks to help you be a better ER nurse. And of course, as always, it's not just me you're going to hear from. I've recruited some of my friends to give you some of their tips and tricks so they can share their knowledge as well. So don't forget to subscribe so that you catch all the episodes. And if you find one of these tips and tricks are really helpful, give me a shout out on social media and share it with your friends. Let's get into today's tip. It is day 15 of the 30-day podcast challenge. 30 days to being a badass ER nurse. And on this weekend day, like I told you, I'm going to give you some peds tips. This one's kind of a bonus tip because it would work for either peds or adults. The next tip is from my friend Bill Light. Enjoy.
So my name is Bill Light, and here's my tip to making you a badass ED nurse. So if you ever had a patient who comes in with dried blood on them, say they have a head lack and they have dried blood all in their hair, maybe facial hair, chest hair, or body hair, or whatever you got. Best way to get it off, don't waste your time with peroxide, 'cause that's caustic to the wound bed, or don't scrub it with saline or anything like that, because they're going to whine, right? Take Surgilube, water-based lube, takes it right off. If you weren't aware of it, it dissolves blood. It's amazing, right? Nurse taught me this years ago. Amazing nurse from the Portland area named Sherlyn Dolman. Just FYI, she's amazing. She taught me this about 2008. And it's an amazing tip. Now, Surgilube is sterile, right? So you could potentially put it in the wound bed. I'm not saying you should douse the wound bed in Surgilube, but it would. All you do, take a gloved hand, you put a pile of lube in there, you just smear it on, make a thick sort of layer of lube on any place that has dried blood, let it set for 3 to 5 minutes. The lube will start to turn brown as it's dissolving that blood. Then you just take a dry square of gauze. So take like a 10-pack of 4x4s of gauze. Make sure they're dry because water and lube don't mix, right? So just take dry gauze and wipe right across it. It takes it all off just like that. Instant clean skin. Now, if it's in, like, say you have someone with a lot of thick hair and you have big clumps of matted, dried blood in there, you might have to do a little massaging of it. So you can still, in that gloved hand, put the lube in there and then just sort of massage the clot there, and it might take a little bit longer, but it'll still come out. And then you just hold the base of the hair and take the just fold the gauze over the hair and then just strip it out. Just pull it out and it'll take that off. It also, oddly enough, it also will take the pink out of white hair. Little grandma or grandpa who has blood in their hair and turns their hair pink, it'll also strip that out. Peroxide would do it, but it'll also just color the hair, so you might not want to do that. It'll also strip color out of hair, so maybe don't do that. But that's my tip for you. Other nice feature of it, like let's say if you're from a state that you can inject and numb your own wounds. So in my state, nurses we numb the wounds. So like let's say you have a kid that comes in, maybe their house pet, like a Chihuahua or something, maybe it bit them. And so that kind of dog might have like bite. They might have little punctures, multiple punctures on them. And if you have little spots of dried blood all over their arm, or wherever, if it's all dried, you might not know which are the holes to actually numb and which one are just spots of dried blood on them. Well, so you'd have to scrub it to find the holes to numb. I mean, that's going to hurt, right? So if you just take the lube, put the lube over all of it, it'll dissolve the blood out of the lacerations, and they'll start to ooze, so you know exactly where to numb. And it doesn't hurt, because remember, the laceration only stings because it's oxidizing, has an oxidation reaction on the laceration. So when you cover it with lube, it actually stops the oxidation reaction. So it makes them stop stinging. Another little fun fact, right? So it's a win-win. Now there's a few contraindications though, right? If the person reported like spurting blood, so an arterial bleed, just a few things. And like on road rash, maybe don't put lube on that. That's not really going to be helpful. But other than that, if you're just trying to get that off, a nice fun fact. Hope that helps you.
Thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.